Hello, guys. Welcome to another TGIF episode of the Anti-Pharmacist podcast. Where did time go again? I can't believe it's been 1 week since I had that chat about malaria research with Belumi. Anyways, I welcome you to another episode today. And on today's episode, I want to talk about something, right, that just dropped in my mind. You see, many times, healthcare providers tend to focus on the patient, and rightly so, because, they are our primary concern. They are the ones with the disease condition that we're trying to alleviate or cure. So, who else should we face, right? But then I thought that, what about the caregivers? The people that actually brought these patients to the hospitals or to the pharmacies, as the case may be, or the people that actually oversee their care and take care of them back at home after they have been discharged, for example. What about them? Who cares for the caregivers? So, today's episode is just to address this group of people, the people that care for patients with chronic diseases, like, for example, stroke patients with arthritis, with dementia, with Alzheimer's, with diabetes. Sometimes it could be age related, like the Alzheimer's or dementia. Sometimes it could just be independent of age or unrelated to age. There are children that have juvenile diabetes, right? And their parents that take care of them. There are also sickle cell patients, the family members, the parents, the siblings. These people constitute the caregivers, and most times their care is overlooked because, they are not the sick person. But did you know that a caregiver can easily become a patient if care is not taken? Because a lot of pressure is on them. They want to see their loved one become better. So some of them even, they face some mental strains, some physical stress that, if care is not taken, could impact their health, could affect their health adversely. And that is why I call the topic of today's episode to the caregivers. Like, I'm addressing you now directly. You caregiver that has been taking care of your loved one who is sick. I'm addressing you today. Alright? Let's look at you. Let's also, take care of you. Know that you are not alone. Know that somebody cares for you as well. Because, like I said, a caregiver could easily become a patient if care is not taken. For example, there have been times in the past when patients, are brought to the hospital by a member of the family, and before you know it, this member of the family become admitted themselves because they are fallen sick. In the hospital environment, there are nosocomial infections that could easily be contracted by these people. They care less about themselves. All they focus on is the patient, so they just sleep anywhere. Sometimes they forget to eat. They are running around. It takes a physical and mental toll on them, and before you know it, they are sick. Many a times you see patient relative coming to buy paracetamol. They have headaches because they have been running around. So I've come to educate the caregivers today, alright, to tell them that there are things to put in place to avoid becoming a patient. So I'll be talking in terms of two things: your mental health first, then your physical health. Alright. Studies have shown that many caregivers tend to come down with mental health issues like depression, like anxiety. And this is a direct effect of they taking care of that family member, that friend or relative, that is sick. Why should you suffer health issues just because you're taking care of somebody? I know that it's not that easy. I know that you care so much about your family, your friend, this relative of yours. You don't want to lose them, and you're doing everything in your power to ensure that they're fine. It's taking not only mental toll on you, it's taking the physical toll on you. You have to worry about, they getting better. You have to worry about paying the bills, getting their medications, taking care of them, making sure that they get their medication when they should, and all of that. This could take tolls on you. So what can you do to at least reduce this stress on yourself so that it doesn't affect you adversely? Number one is stay calm. Just know that not everything can be under your control. Of course, you don't like that condition in which your loved one is, fine. But then it has gotten to a point that you can do nothing about it, right? So the only thing that you can do about it is first stay calm. All right? Stay calm. Then listen to the healthcare providers. Do as much as you can and don't strain yourself. You see, do what the healthcare provider says you should do. If you're confused, ask for direction. Speak to the doctor, speak to the pharmacist. I'm sure that they can help you. When you're getting tired mentally, just take a step back. These are things that you can outsource. In terms of the financial burden, I talked about being able to take some things on credit. A while back on this podcast, I talked about health insurance. You can explore those options. You could reach out to people, to NGOs that could help. You see, this could apply, like I said, to people taking care of stroke patients, to people taking care of elderly with dementia, with Alzheimer's, to people taking care of people with diabetes, even people with cancer. You could reach out to agencies, to NGOs that could help these people. That's for the financial burden. Like I said, calm down. You see, if you're starting to worry too much, just seek help from healthcare providers, like I said, or from family members, from friends. Talk about it. Oh, I don't like how my husband is now. It's taking a toll on me. That word of comfort by somebody might just be what you need at that time. Then don't isolate yourself. You see, don't isolate yourself. Maybe this person is unconscious, for example, or they are not really there anymore in terms of mental acuity. You cannot have maybe conversations with them. Speak to other people. And if you can still have conversations with them, gist with them as much as you can. Make it fun as much as you can. You see, even if it's somebody that has dementia, for example, you could play games with them, take out the family album, discuss it, try just to remember the good memories. Don't dwell on that situation because it could actually affect you mentally. I met a patient relative recently and she was already giving up. I had to encourage her. She actually spoke up. She was crying because the relative actually had a mental health issue. That's another thing. Mental health patients too, they have caregivers because it gets to a point they can't take care of themselves anymore. They can't take their medications by themselves. You see, some are outpatients, some are inpatients. So you just speak to somebody that would understand you. They would encourage you. They would tell you what to do. You know how to make it better. Be calm. Speak out. Seek for help. These are things that you can do. Then, looking at the physical stress, running around, carrying them, washing them, taking care of them. You may not be able to do all this by yourself, especially if you are even elderly. There are people that it's their wives that are taking care of them. There are people that it's their husbands that are taking care of them. There are children that they are only child, that they don't have anybody to help. You can outsource. Outsourcing is fine. Outside Nigeria, there are old people homes. There are caregivers that are actually paid to take care of sick people. And I think it's coming up gradually in Nigeria too. It's something that people can get paid to do. So why not outsource it? Instead of doing it alone and bearing all the burden, get somebody to help. Pay them something. I've had patients in the past, all right, whose children are not even in Nigeria. They just contact the pharmacy. They speak directly to me, the pharmacist, and they pay for the medications and everything that is needed to take care of their elderly father. The caregiver comes and takes all of this, takes care of the father, and everything is fine. The man was well taken care of before he died in his good old age. You see, so these are things that you can do. Don't be the one running around and doing everything. If you don't want a stranger to take care of your loved one, you can rotate it amongst the family members. Maybe you do 1 week, another sibling comes and does another week. But remember that this could take a toll on you, yourself, your livelihood, your work. It could even cause financial strains because you're not able to go to your work while you're taking care of that person, except you're earning some kind of passive income. But still, you have to oversee your businesses no matter what. So still, outsourcing is still the best option. You can come, supervise, You can come check in on them from time to time, but do not let the whole burden be on you, such that you now become the patient. It is very important. Don't forget to eat while you are there feeding them or sitting at their bedside all day. Let the healthcare providers do their job. Don't be all finicky and looking at everything they are doing. Just step back. Stay in your lane, so to speak. Let the healthcare providers do what they can and you do what you can. Alright? Because I've seen that caring for a sick person can actually take a toll on you. Like I said, research has shown this. So you as the caregiver, just calm down. Let things go as they should. Anything can happen. Yes, nobody prepares for these things. But once they happen, take it in stride and just calm down. Take care of your own health. Take supplements yourself to give you energy. Eat good food. Don't just focus on the patient and neglect yourself. Because at the end of the day, if you fall sick, who will be there to take care of the patient? So that is what I've actually come to tell you today. Alright? So, dear caregiver, take care of yourself as well. So, dear caregiver, take care of yourself as well. If you have to outsource, please do. If you need help, please speak up. Do not stay alone and cover it all up. It might actually affect your mental and physical health. And with that, I end today's episode once again. Thank you so much for listening. And to those that have been subscribing, that have been following, liking our content, I appreciate you a whole lot. But please do not stop there. Continue to subscribe, to listen, to follow, and to share this podcast. It is very, very important. Your feedbacks as well are very important to me. I cannot trade them for anything. When I see a comment, I'm usually very happy. Ask your questions as well. Your questions might point me in a direction I did not even think about, and your comments too might encourage me to do something differently. They're actually feedbacks that I do need to grow this podcast even better than it is right now. Thank you so much once again for listening. Please communicate with me via social media on X, on IG, on LinkedIn. I'll be very happy to connect with you. Till next time, stay healthy and God bless you.